And in this video, I'm going to explain what ExoMind is, how it works, who it may help, and what patients can expect during treatment and over the course of a series. I use ExoMind in my practice as a medical treatment for patients who are struggling with mood changes, anxiety, burnout, brain fog, trouble focusing, and difficulty with mental stamina and day-to-day functioning. My goal with this video is to help you understand how this treatment works and when it may be appropriate. So let's start with the basics. ExoMind is a non-invasive brain stimulation treatment. It works on the brain, not on the muscles, and not on the body. The purpose of treatment is to help the brain work in a more steady, organized, and efficient way, especially in areas that affect mood, focus, motivation, and mental clarity. We see patients who are dealing with low mood, anxiety, stress overload, emotional fatigue, burnout, brain fog, difficulty concentrating, or difficulty planning and organizing thoughts and tasks. We also see patients who feel like they're not themselves, who are struggling to keep up mentally, or who feel like their brain is tired all the time. ExoMind is not meant for psychiatric emergencies, crisis situations, or unstable medical conditions. In my practice, it is used as part of a thoughtful, structured treatment plan. When appropriate, it works alongside therapy, medication management, lifestyle work, or other medical care, not in place of them. So here's how a typical session works. During treatment, you will lie on a very comfortable bed, and a small device is placed on the scalp in the area where we're targeting. In this case, it is the left prefrontal cortex of your brain. You may feel a light tapping or pulsing sensation. Some people describe it as rhythmic or gentle pressure. You are awake the entire time and you're able to talk. There's no anesthesia and there's no sedation. And most people return to normal activities right after their session. A full course of treatment is a series of 6 sessions, usually spaced over several weeks. Some patients notice early changes in energy or clarity, sometimes around the 3rd or 4th session. Others notice more gradual changes by the end of the series, such as better mental stamina, steadier mood, less overwhelm, or improved focus and organization. Because the brain adapts over time, consistency across the full series is important. In my practice, we complete a baseline assessment before starting treatment. We check in partway through the series, and then we review progress after the final session so we can track meaningful changes. Most patients tolerate ExoMind very well. Possible short-term effects may include mild scalp tenderness, light headache, temporary fatigue, or emotional release during or after a session. And these are usually mild and pass on their own. Before anyone begins treatment, I review their medical history, neurologic history, medications, implants or devices, and any prior brain-related conditions just to make sure ExoMind is safe and appropriate for them. Now, people often ask how ExoMind is different from traditional TMS or transcranial magnetic stimulation. Well, both are forms of brain stimulation. Traditional TMS is typically used in a very specific way for major depression and is often delivered inside an insurance-based model. In my practice, ExoMind is used more broadly to support mood stability, stress recovery, cognitive function, and day-to-day mental performance, especially in patients dealing with burnout, brain fog, anxiety symptoms. So the intention of treatment in my setting is to help patients function better, think more clearly, feel more grounded, and regain a sense of control and capacity in their daily lives. So if you're struggling with mood changes, mental fatigue, focus problems, burnout, or brain fog, and you'd like to discuss whether ExoMind may be appropriate for you, you can contact my office to schedule a medical consultation. We will review your history, your symptoms, your goals, and determine whether this treatment is a good fit. Thank you for watching, and I look forward to seeing you in a future video. And if you like this video, just like and subscribe to my channel and go to my website at intentionalaesthetics.com. Thanks.